Now that your treatment has been planned, it's time for your first radiation treatment appointment.
I didn't think any more about it until it was brought to my attention. You're going to have to start radiation therapy next week. So I pushed back a little again and said, no, not next week, the week after. I'm not ready.
Oh, I'm really going for radiation, like this is really happening to me.
I had no idea what radiation therapy was.
First thing that comes to mind is burning.
Are you going to be radioactive?
Microwaves and nuclear bombs.
It was an irrational fear of being, quote unquote, cooked inside out.
For the most part, it's not nearly as bad as people think it will be. It's very fast, and we do try everything we can to make you as comfortable as possible.
I continued to go to work right up until the day before my radiation treatment. I feel in my situation that was good because it kept my mind off of things. I didn't have time to really worry about things.
Before your first treatment, we'll inform you of any preparations needed for that day.
For example, prostate patient will have preparation they'll have to do for their bladder, like they have to have a full bladder, have to drink a certain amount of water. But that instruction will be given to them during their planning appointment. So if there was no instructions given to them at the planning appointment, there's not much they have to do to prepare. They just have to show up, and we'll do the rest. During the course of your treatment, you'll have to travel to the hospital daily.
I was really happy that I was getting my radiation treatment at Princess Margaret because I could walk from where I live.
I travel to my appointments by TTC, by public transport, and I get home by public transport.
Public transportation or walking may not be feasible depending on where you live and how well you feel throughout your treatment.
For people locally, there are drivers available or transportation available if you so choose.
If you live farther away, there are other travel options available to you, such as arranging a volunteer driver through the Canadian Cancer Society. Princess Margaret also offers accommodations at the nearby Princess Margaret Lodge for those of you living outside of the Greater Toronto Area.
There's the lodge that you can go to and stay at, and they transport you back and forth to the hospital. This is perfect for people from out of town. You can't drive back and forth from a place like Collingwood to get treatment. It's just not feasible.
Bringing a relative or a friend to your appointments can help you deal physically and emotionally with the treatment.
I would recommend bringing someone with you when you come to the appointments. It's just nice, reassuring, especially in the beginning, and it's nice to just have someone there that you know and love to come and, greet you after your appointments.
On your first day of treatment, check in and show your card to the patient flow coordinator at the reception desk. For every appointment after the first one, you'll check yourself in.
I was very surprised at how quickly they call you in for your appointment. The staff is very, very informative.
They make sure that you're feeling comfortable through the whole process and ensuring that if you have any questions, they're totally open to answering any concerns.
During the course of treatment, you'll be scheduled to one treatment unit. This unit and a small team of radiation therapists assigned to this unit will likely remain the same every day during your entire course of treatment.
When you walk in the room, most of what you see, you definitely have a sense of familiarity with it because it's very similar to when you get your CT scan.
At the start of every treatment, the radiation therapists will ask you for your date of birth, even when they get to know you well. This is to ensure that the correct treatment plan and information are loaded into the computer. The radiation therapist will position you on the bed in the same way that you were positioned for your CT simulation scan, according to the notes in your treatment chart.
Once you're positioned and they have all that equipment pulled out, the therapist will step outside the room, but you're never actually alone in the room. There are 2 cameras on you at all times. There's an intercom system as well, so if you need us, all you have to do is call out and come straight back into the room.
They can see, they can hear you. If you have any problems whatsoever, you just speak to them and they will come back in and address whatever the situation is.
A machine will take images of you to ensure that the treatment area matches exactly as planned. Once that's complete, radiation will start.
So after we've imaged you to make sure that you're in the most reproducible position, the same position from day to day, then we give the radiation beam. So it's a two-step process.
During the treatment, there are many ways to help keep yourself relaxed and comfortable.
For example, music that plays in the radiation therapy unit room, and the patients can bring whatever music they find most relaxing to help them go through this experience.
Think about, really positive things and just trying to stay as relaxed as I can. And
I like to think of a beach in the Caribbean.
On my chart, they have lights off, music on.
It's painless, so far.
When the radiation is happening, you don't feel anything. They explained that the machine is not going to fall on you, it's not going to come near you, it's not going to touch you.
The machine circles back around you again, and they come in and thank you very much, and you can go home. They're a terrific group of people.
Now that your appointment is over, you are free to leave the hospital.
Treatment appointments are anywhere from 15 to 30 minutes, depending on the site that's being treated, and it depends on the type of plan that's been created specifically for you for your treatment area.
The whole process between getting in the room, getting in position, having the therapy, and leaving can often be less than 10 minutes.
As the treatment goes along, you become very familiar. It almost becomes like this is your new job. You just come, you do your treatment, and you go and go home and carry on with your regular life.
Doing my daily activities as much as I could, to the extent that I could, kept me happy.
During the course of treatment, the radiation therapists can assist you on a daily basis with the management of any side effects and any concerns about treatment.
Throughout the course of treatment, it's not like we stop giving education to the patient. Regardless of which therapist they see on the treatment unit, we will always be assessing them daily.
Therapists who are well versed in the treatment they're delivering and the side effects to experience and know well when to ask for help and send them to a nursing clinic for evaluation.
You'll also see your radiation oncologist and often a specialized oncology nurse on a weekly basis.
Prior to meeting with my doctor, there is a form that I fill out that goes through about 12 different questions, including tiredness, loss of appetite, emotion.
We will physically examine the patients, and more importantly, we'll ask them about the development of specific symptoms.
I maybe tire a little easier.
I've had some skin breaking underneath the breast area.
the first week of radiation, I definitely felt fatigue.
When I sleep at night, sometimes it's not comfortable to lay on that side, but for the most part, I'm not in any pain.
The side effects and symptoms of treatment will come on slowly over a course of many weeks, and it takes many weeks for them to go away.
There is a dedicated radiation nursing clinic available to all patients who may need extra support to manage side effects. It's staffed by oncology nurses and operates on a drop-in basis. Your specialized oncology nurse is there to help you. Don't hesitate to ask about your side effects or any other concerns you may have.
In the radiation nursing clinic, patients can drop in at any point from their planning up until 2 weeks after treatment. It's really based on the patient's needs. The oncologists see the patients weekly and review, and if they think there's a patient that may be struggling or need a bit more supportive care or education, they'll refer the patient to the clinic, and they'll speak with myself or one of the nurses, other nurses there, to discuss some of the patient's concerns so that we can work together to really come up with a good treatment plan.
initially you don't know what will help or work. I was quite nonverbal because I was terrified.
If we give some advice on how to manage something and it's not working for the patient, that it's very important that they let us know. If something is bothering them, not to let it escalate. We'd rather know sooner than later so that we can best help them.
I confess I didn't do enough homework or background work on radiation therapy through what was offered here at Princess Margaret. And I think maybe I shortchanged myself on that by not doing that. I think it would have probably helped me.
Not only do you have the support from the core radiation therapy team, there are also a variety of additional resources that you can be directed to depending on your needs and wishes.
For example, if a patient's having trouble managing what they're eating, we can refer them to a dietitian. If they're having trouble swallowing, we have a specialist called speech-language pathologist who could see them. And if you're feeling down or that you need to speak to someone, we have social work and psychiatrists also available.
The principle of care here at University Health Network in Princess Margaret Hospital is patient-centered care. And everything that we do is focused on what is in the best interest of a patient's outcome and their experience.